It's great whenever an established medical treatment for one problem finds that it's also effective to treat another condition when it actually does work. The question is, does it? Well, that's one of the things we're talking about now with Dr. Syed Hussain from Trinity Health in New England as he joins us this morning. Good to see you again, sir.
Likewise, Tim.
I got two sort of situations here. The first, we're talking about deep brain stimulation. We know it seems to work well for Parkinson's disease, for epilepsy, and now some people are saying it could work for severe depression. What do we know and what do we not know?
Yeah, the jury's out on this, Tim. There's still research that's ongoing. The FDA will probably weigh in at some point later this year or early next year, but there is research that's continuing to assess whether this really will help patients with severe depression that's refractory to medication. So it's a very smaller subset of the general population that may suffer from depression and are on medication. So basically, it's like a brain pacemaker. It's got electrodes that go into the brain. There's a pacemaker-like device that goes under the skin in the chest, and it continuously sends electrical impulses that help with this mood disorder.
So we'll just have to wait and see. And that's something we say a lot, and we mean it. There's not a yes or no on this one. All right, next sort of example here, Xolair. That's a medicine that's already used for, I guess, severe asthma. But there's some evidence, I guess, that it could be used to help treat food allergies.
Yeah, this is new FDA approval for this medication to be used in patients who may have severe allergic food reactions. So peanuts, milk, eggs. What it doesn't mean is that now by taking this medication, which by the way is a shot every 2 to 4 weeks, you can start eating all of these substances. And what it does is it will help the immune system to not react in a severe manner so that these people, if they encounter peanuts or milk or eggs or whatever food substances they're allergic to, don't mount a severe allergic reaction.
Yeah, so it's not going to fix everything. It's just going to stop it from being less deadly.
That's right. That's
the way to look at it. All right, and now we're mentioning Xolair as an asthma medication. It seems that a lot of parents and doctors are still scrambling for children's asthma medications. It's because the drug Flovent has been replaced with a generic version called fluticasone, but then that's been hard to come by too. So what should parents know if they're having trouble getting these medications?
This is an ongoing problem, Tim. This is when the manufacturer pulled Flovent. Now there's a generic medication. Sometimes folks are encountering insurance issues, and sometimes it's just availability of medication. It's a problem. There's no easy solution right now. But folks need to step in. Public health folks need to step in. We've talked about how some medications are short from time to time, and there's generic medications that in the past we've had to get shipped from other countries such as Canada. So things need to start on this track as well for this particular medication, given its importance for children with severe asthma.
Okay, something we'll keep an eye on there. Lastly, big event coming up this Saturday. We've been talking about how this is Men's Health Month. I guess this is an event to sort of show that men's health is community health.
Yeah, we're excited to host this event again, Tim. This is in partnership with the University of Connecticut and other community organizations that Trinity Health of New England partners. It's at St. Francis Hospital from 10 a.m. to 2. It's open to all men, and what will happen is participants will get a chance to interact with our physician experts, but also get screening, whether it's for high blood pressure, it's for diabetes, getting a glucose, for instance, tested, prostate cancer screening, and things. Yeah, things of that nature, which is really, really important. We've talked about how men's health is so important, and men are, not always the best in terms of seeing a doctor and being up to date with health screenings.
Yeah, we were just talking about that yesterday with Dr. Kazi from Trinity Health of New England about men's heart health too. We're not as good as we should be. Definitely not as good with women. So yeah, making as few barriers as possible. I think that's a great help, and that's exactly.
And we
what
also
this
want to
is
make
about.
Absolutely. We also want to make sure that we try to do our part in terms of removing health inequities, right? Communities that have been impacted more and that have less access to healthcare historically, these community events help them. And partnering with community organizations gets them out to these sites.
Yes, because a lot of those communities are right within Hartford, just like St. Francis Hospital is right there, so it makes perfect sense to have it. Dr. Hussain, good to see you again.
Likewise, thank you.
He joins us as he does every week to share his knowledge, guys, and we appreciate it.